everyone. My name is Jen Pettis, and let me see who we need to mute. Somebody's talking. Carrie's talking. There we go. All righty. So welcome. My name is Jen Pettis, and I am the Director of Strategic Alliances at the Gerontological Society of America. And I am a proud ANA New York member and nurse from right here in Clifton Park, New York, just north of Albany. And it's my pleasure to join my colleagues and my friend and colleague, Erica. I have had the pleasure of being on the board of directors for the local Alzheimer's Association for several years, and I've known Erica a very long time. And she does a great job there at the association, now at a statewide really improvement role. So we get to present pretty often together, and we have the pleasure of telling you about the facts and figures today. So there is an annual facts and figures report that comes out from the Alzheimer's Association, and it really is looking at the burden of Alzheimer's and really all dementias on people that have the disease, people who care for or otherwise support people with the disease, as well as the healthcare system and the cost and things. So every year there's also a special report that accompanies the facts and figures, and this year it's all about brain health. So really, we've learned a lot over the past several years about what people can do to reduce their risk for dementia or Alzheimer's. And I'm always careful to say reduce your risk. It's not something you can say we can prevent this disease, but you certainly can reduce your risk. So we want to be careful. There's some people that, regardless of what they do, will have Alzheimer's. And as I prepared for this, I looked back to say, when was the first facts and figures that we actually did? And our first facts and figures report was in 2007, which was 101 years after Alois Alzheimer over in Germany presented a case at a very small medical conference about a 51-year-old woman who had memory loss, confusion, disorientation. She had unfounded suspicions. And that disease, that condition that he presented at that small conference was what we now know as Alzheimer's disease. And so in that facts and figures, just a little under 20 years ago, so 2007, there were four.
Yeah, no, you're fine. It's a webinar. You're good.
There were 4.9 million people living with Alzheimer's. And so this is just a little under 20 years ago. And now we're up to, you'll see this big number of over 7 million people in our country that live with Alzheimer's. So each year there is an infographic that accompanies the report that really highlights some of the major findings. And this is just a snapshot of that. And I'll review many of these highlights with you on the next several slides. There are some key takeaways. There are some key takeaways of the report, and we'll starting with that 7.4 million people, and that is people with clinical Alzheimer's dementia. So these are not people with mild cognitive impairment. These are not people who have either the genes for or the biomarkers for Alzheimer's, but haven't yet become symptomatic. So these are people living with clinical Alzheimer's disease. And you'll see that the deaths due to Alzheimer's have more than doubled in the last 24 years. At the same time, our deaths from heart disease, the leading cause of death in our country, has decreased. More people die each year from Alzheimer's than from breast cancer and prostate cancer combined. And I think that's important to mention. There is 13 million Americans providing care for people living with Alzheimer's, and that accounts for 19 billion hours that friends and family are providing care, and that value of that care is $446 billion. So tons and tons of care that families are providing. And also there's more than 772, that should be 1,000, I believe, no, million, direct care workers that are needed by 2034 to care for people. And so as we're looking ahead to the needs that are going to come over the next decade due to the rising population with people with Alzheimer's and dementia, we know we need more people to provide direct care, and greater increase in that than we need an increase in any other workforce. And we also look at the cost of care in 2025 for people for our country as caring for people with Alzheimer's dementia is $409 billion. And by 2050, we expect this cost to rise to nearly $1 trillion. So the cost is just booming. Our population is aging. The amount of people with dementia and Alzheimer's will continue to grow. And we really, we think of this, at least I do, as the public health crisis of our time. And so again, the prevalence, 7.4 million Americans living with clinical Alzheimer's dementia. And as we look at these numbers, you can see back from 2010 when we first looked at how many people, that was 5.3 million. And our chart here starts at 2020 when we have 6.1 million people, and now up to 7.4 million people. And this is older adults, it's people 65 plus. There are people also under 65 with early onset Alzheimer's, and we'll talk about that as well. And then when we say who is affected here, we look at it's 2/3 of Americans with Alzheimer's are women. So women are disproportionately impacted, keeping in mind that women live longer. Women are probably less likely to have to die from heart disease, from accidents, from things like that. So there's a lot going into that number of women. You'll see in a bit that women are also disproportionately the caregivers of people with Alzheimer's. And it's important to note that non-white Americans, particularly older Blacks and African Americans, are twice as likely to have Alzheimer's, and people that are non-Hispanic whites are also much more likely to have Alzheimer's disease. We know that social determinants of health play a significant role, and we know that people in these communities are disproportionately negatively impacted by social determinants of health. We need more studies on other populations. We look at population groups at these two that I mentioned, at white Americans, but we certainly need more studies. And then what about by our state? So this report does a really good job at breaking down state level data. And you can see here that we have about 426,500 people in New York that are living with Alzheimer's. We also see here that our numbers, continue to rise. We are spending a great deal of money on caring for people with Alzheimer's. And we also, you can see with workforce statistics that are on this slide. In 2021, New York State had 714 geriatricians, so not very many. So we certainly need an increase in the number of geriatricians. We need much more increase in home health aides and personal care aides to meet the demands. And unfortunately, people are just not choosing this type of work. In fact, when you look at geriatric residencies and things like that, they're just simply not filled in our state and in others, and people are not entering the direct care workforce. I always say someone can go to the local sandwich shop and make more an hour than they can working in a nursing home or as a home health aide. And when we look, oops, I think I'm got my slides mixed up here. Sorry about that. When we look at prevalence by state, it is really important to note that it varies greatly. Washington, D.C. is not listed here, but Washington, D.C. does have the highest prevalence. And New York is right up there, looking at prevalence as well. We are at 12.7% is our statewide prevalence. And I mentioned to you with mortality and morbidity, Alzheimer's disease does take more lives than breast cancer and prostate cancer. And it is the 5th leading cause of death among individuals 65 and older. I would argue, having been a nurse a long time and seen an awful lot of death certificates, that you tend to see things like heart disease written more often, even if someone has Alzheimer's. In fact, that has led them to be dependent and really nearing the end of their life as far as ADL function and the ability to eat and things like that, we tend to often not see that documented. And I mentioned this already, that is the 5th leading cause of death, but the deaths due to Alzheimer's have increased by 134% between 2000 and 2024. And again, that heart disease number has decreased. So what is the burden of disease? Alzheimer's begins about 20 years, the actual onset of disease, of plaques and tangles and things in one's brain begin about 20 years before they actually begin to show symptoms. There is tons and tons of work happening right now in what we call preclinical or pre-symptomatic Alzheimer's disease. People that are 65 plus who get a diagnosis of Alzheimer's disease tend to survive 4 to 8 years after diagnosis, but can survive up to 20 years. I would certainly add into this that we know people are not diagnosed in the early stages of disease most of the time. It's there's a big push to try to get people diagnosed in the mild cognitive impairment or early Alzheimer's stage, as there are disease-modifying treatments that can slow the progression of disease. But they are only available to people if they're diagnosed in the early stage. So we need to do better with identifying cognitive impairment. If someone is 80 years old and they, about 75% of people that are 80 or older that have Alzheimer's dementia live in a nursing home, where if you look at the general population, so people without the condition, only 4% of the general population live in the nursing home that are 80 or older. I actually have a dinner date and shopping date with my 89-year-old neighbor today. He does a great job. He's totally cognitively intact and living super independently. So we know if people age well with their mind and their physical health, they can do really well. And then again, when we look at this duration of disease of Alzheimer's, when it truly spans years, if not decades, we know that people, this is a significant burden to our public health system. Again, I would say it's the public health crisis of our time. And so let's talk about risk factors. Erica is going to really lead you through an awful lot about risk and risk reduction. But we know that age is the greatest risk factor. Oops, my slides are doing crazy things here now too. Today is not our day with tech. As someone ages at the age of 65, their risk for Alzheimer's doubles every 5 years. 34% of people that are 85 or older actually have Alzheimer's. What is going on with this thing? Family history is a known risk factor. In fact, we will talk, we won't talk about it today, but there is what we call familial Alzheimer's. People who have a gene who know they are going to, if they've inherited that gene, they will have Alzheimer's. So early onset or familiar Alzheimer's disease. And we know that the genes I just mentioned, we know that there are genes that put individuals at risk, and then there are those deterministic or familiar genes that someone who has that will absolutely develop Alzheimer's disease. And I mentioned already that Black Americans are twice as likely as white Americans to develop the disease. And for some reason, they are higher prevalence. Oh, for God's sakes, they are higher prevalence of other conditions as well. For example, I mentioned the issue of social determinants of health already. People with that are Black certainly have higher risk of heart disease and are also much more likely to have issues with other social determinants of health. And we also have issues around involving Black Americans in research. We know that people believe that research is biased as well. Hispanic Americans are 1.5 times more likely. I have no idea why my slides keep going forward. I don't know if there's something that can happen with the tech that can make that stop.
Jen, can you hear me okay?
Yep, I can.
There is a button on the top, if you stop sharing, back on the top of the toolbar that says timing, that you can uncheck. If you're in the slideshow section.
Okay. I have timer, is that it?
Are you in PowerPoint?
Oh, No, okay. So go into the slideshow and
There's a little box that says use timings.
yeah, I'm afraid I don't see it.
You could try the timer button where you were before.
No, I'm in slideshow now. So use timings. Got it. Okay,
Yep,
thank
unclick.
you.
You're welcome.
Okay, let's try that again. Okay, now we're in business. I apologize, ladies, and let me share again. Ladies and gentlemen, I should say. All right, let me share again. Okay, sorry about that, and thank you for your patience. So Hispanic Americans are 1.5 times more likely to have than white Americans to have Alzheimer's or other dementia. Here there are some biological links when we think about rates of heart disease, diabetes, but there's also um, social determinants of health. And many people in this community think that this is just normal aging. And there's certainly the medical providers that feed into this as well. And then again, when we talk about discrimination seeking healthcare in our Hispanic Americans, 1 in 3 report they've experienced discrimination when seeking care. And then women and Alzheimer's. Again, women are disproportionately impacted. 2/3 of the people that live with Alzheimer's disease are women. So if you're a woman of color, your risk is even greater. We first thought this was solely about age, but while we know that age is the greatest risk factor, we know there's probably lots of other things going on, for instance, biological and hormonal difference, and even the difference in the life experience. For example, when you look at levels of stress on a woman versus a man, women are often the caregivers, coming in at 60% of all caregivers, and we know how difficult being a caregiver is. And then the risk factors are that I mentioned, our hormones, biological things are beyond our control. But in a bit, Erica is going to tell you an awful lot about the modifiable risk factors. And then different numbers here on this slide. We're looking at highlights the number of people with Alzheimer's who have other chronic conditions. And I think it's really important to note here that caregivers also have a lot of chronic conditions. In fact, in the case of New York in particular, 61.2% of New York caregivers have other chronic conditions. Over 20% of them have depression, and 15.5% report that they're in poor physical health. So let's look a little more at caregivers. So when we look at our caregivers, nearly 13 million Americans provide that unpaid care. And again, I mentioned that value before. It's $446 billion. And just in New York alone, there's 776,000 caregivers with a total hours of 1.3 billion and the total value of that care at $33.8 billion. And then when we think more about unpaid caregiving, it's 83% of care for older adults in our country. So older adults in general, this is not just people with Alzheimer's, is provided by unpaid members of the family, friends, or other caregivers. Nearly half of those caregivers are helping someone with Alzheimer's or another dementia. And more than 1 in 4 households and nearly 40% of extended families with an older adult include someone living with dementia. Unpaid caregivers also incur a lot of costs. In fact, the total lifetime cost of caring for someone with dementia is more than $400,000, with 70% of those costs borne by family caregivers in the form of unpaid caregiving and out-of-pocket expenses. The doctor said that.
Yeah.
I'm going to just remind everybody that if you haven't muted yourself, we can hear you talking. So just be mindful and double check if you would. And then demographics of caregivers, just a bit here. Who are our caregivers? Like I mentioned before, 2/3 are women, 1/3 are daughters. 1 in 3 is age 65 or older. More than half of primary caregivers take care of their parents, and a quarter of people who are providing care to someone with dementia are in the sandwich generation, taking care of both an aging parent and their child. 2/3 of caregivers are white, 10% are Black, 8% are Hispanic, and 5% are Asian American, and that other 10% is as other racial or ethnic groups. 30% of older adults living with dementia rely on 3 or more unpaid caregivers. So there's lots of people in a lot of people's kind of support circle. And then as we look at state caregiver data, 29 states this year had increases in the number of dementia caregivers, the number of hours spent providing that care, and the value of that unpaid care. And then with the impact of caregiving, this data comes from the CDC's Behavioral Risk Factor and Surveillance System. And we look at the percent of caregivers living with at least one chronic condition, chronic caregivers with reported depression, and again, frequent reported poor health. And I mentioned some of those statistics before. And then there are states with even more new data around caregiving, including New York. And then who is that workforce? When we look at that, the paid workforce, it's almost 750,000 direct care workers that we need by 2034, so just 8 years away. Again, this is a greater need than any other occupation in our country. In addition to needing more people, we need our workforce to be dementia capable, a workforce that's ready to engage in activities such as detection, screening, and diagnosis of dementia. This can't be left to specialists. It needs to happen in primary care because there is a shortage of dementia care specialists. It's definitely a delay to timely and accurate diagnosis, delaying treatments. I mentioned that people who are eligible for treatments for the disease-modifying therapies are only appropriate for them in the very early stages of Alzheimer's. We know that there are about half of Americans, anywhere from a third to over a half of people 65 or older, live in areas that lack dementia care specialists. We need 14,000 more geriatricians to care for the more than 10 million individuals projected to have Alzheimer's in 2050. That's more than double the people who are practicing in 2021. Meanwhile, 50% of geriatric medicine fellowships go unfilled. And in New York, there were only 714 geriatricians. In New York, we need 28% more, 29% more to meet the need as we continue into the 2030s. Direct care workers play an absolutely critical role in caring for individuals with Alzheimer's. Between 2014 and 2024, direct care workers increased from 3.5 to 5.3 million. However, we need that 750,000 more over the next 8 years. And the job growth, when we look at our job growth and we look at public policies and also people who are getting older, their wishes and desires, they want to age in place. People don't want to go into a nursing home. They want to receive care at home, and policies and things are shifting to better allow that to happen. And do remember, even though this is a huge workforce, there's also a huge amount of turnover in the direct care workforce and in the healthcare workforce in general. So we have significant needs there. And we have to mention the cost of care. And this year, we're projecting that the cost for caring for people with Alzheimer's and other dementias will be over $4 million. But when you look at how that cost has ballooned and ballooned and will continue to, we started in 2025, we're at $384 billion, up to $409 billion just a year later. And by 2050, we expect that cost will be $1 trillion to the U.S. economy. And again, by payer, who's paying these costs? Well, Medicare and Medicaid are paying a significant amount of them, but we are also looking at out-of-pocket costs. A quarter of those costs are borne by the individuals with dementia or their family or friends. It's a significant burden on Americans. And then when we look at coexisting conditions, again, this is Medicare data. This is around people with dementia and their comorbid conditions. And so we see coronary artery disease, chronic kidney disease. So people with dementia don't just have dementia, they have other conditions. And these conditions are those that often become unstable and the things that result in rehospitalizations and difficulty to manage overall health and well-being for the individuals. And at this time, I'm going to have the pleasure of turning it over to my friend and colleague, Erica, who's going to tell you about our special report.
Great. Thank you so much, Jen. Hoping everybody can hear me okay without the echo. You can go ahead and advance to the next slide, Jen. So as Jen mentioned, we every year with the Facts and Figures report, a special report comes out, and I was so excited this year to learn that it was on brain health. One of the key points that Jen brought up early on in this presentation was that we have learned through scientific advancements that the biological changes associated with Alzheimer's disease can occur up to 20 years before that first symptom is displayed. So that really led us down a different path. You know, we are always going to care and provide care and support for people who wonder if they have this disease and do have the disease, and the caregivers that provide the care. But we thought, with a number like that, and with those changes occurring so far in advance of those symptoms, we really need to look at this disease through a different lens. And Jen hit the nail on the head. A public health approach is really what is necessary here. So this is really exciting because we really have taken a very hard look at a lot of risk factors that we know are associated with Alzheimer's disease. And you can see from this slide that there are many more modifiable risk factors and things that we can actually change than there are non-modifiable risk factors. So of course, on the non-modifiable side, we have age and genetics. But on the modifiable side, we're learning that there are a lot of things that you can do, not necessarily to prevent, but to reduce your risk of developing dementia and Alzheimer's disease. And those are things like physical activity, eating a brain healthy diet, getting really good quality sleep, which we'll talk about in a little bit, preventing head injuries, taking care of your heart, your blood pressure. So we've got a lot of research going on right now that are looking at these specific risk factors, and our role now is almost a dual role, right? We are still trying to get people diagnosed as early as possible because of those new treatments that Jen mentioned. We are still caring and supporting the folks that have this disease and their care partners, but now we've got to get this risk reduction really out into the community, because as Jen mentioned, we know the people that are at a higher risk of developing this disease. We've got to let them know how important brain health is to their future. So on the next slide, taking a look at, some of the things that people can do. There is data and scientific evidence in all 10 of these areas that say if you make a positive change in these areas, you can reduce your risk of cognitive decline and possibly Alzheimer's and dementia. And in fact, the Lancet Commission put out a report a few years back that stated that up to 45% of dementia cases could be prevented or delayed by targeting these modifiable risk factors. So if you do one of the things around the circle, that's great. If you do two, but research is suggesting that the more of these healthy lifestyle behaviors you combine, that is going to be the most impactful to your brain health. And of course, we still have those non-modifiable ones, but the evidence in these areas, some of the evidence is proving to be so strong that it almost offsets that the genetic risk and those non-modifiable risk factors. So really a positive step in terms of how we can reduce our risk. And that led us down this path of really talking about brain health. So before we get into the special report, I wanted to talk to you about this particular study. You may be familiar with it. This was the US Pointer study. The results came out almost a couple years ago now. And we've got several different offshoot studies building on these findings. But the Pointer study was really the first, largest study that looked at lifestyle implications to dementia risk reduction. So in this study, it was a 2-year study, over 2,000 participants. There were 2 different groups. There was a self-guided group and a structured intervention group. And both of those groups had to participate in a physical activity component, a nutrition component, there was an intellectual engagement component, and then some health coaching. Now, the difference in the 2 cohorts was that the structured group really got some specific direction. We said to them, you're going to want to follow this type of physical activity program. You're going to choose this type of brain healthy diet. The self-guided group, we gave them some options. They picked what they wanted to do. Both groups got a little bit of coaching, but the structured group got much more follow through, course correction, and guidance through the 2-year study. On the next slide, you can see what some of the results were. So the positive news here is that both groups at the end of the 2 years did very well. So by participating in some of those healthy lifestyle choices, we saw that they had overall improvements in their global cognitive function. So their executive function improved, their memory improved, and their processing speed improved. Not surprising probably to any of us that the structured group, who had more coaching and more guidance and more accountability, did a little bit better. But overall, great results. And this led us really to being able to share what we call the US Pointer Brain Health Recipe. So I always, share the disclaimer that there are other types of exercise and other diets that are also good for your brain. This was the intervention that was used in the structured group in the US Pointer study. So for physical exercise, they did 30 to 35 minutes of moderate to intense aerobic activity 4 times a week, also strength and flexibility training. For nutrition, they adhered to the MIND diet. So that is a hybrid, really a hybrid between the DASH diet for hypertension and the Mediterranean diet. For cognitive exercise, this group participated in a program called Brain HQ, and they did that 3 times a week for 30 minutes, plus other activities that were engaging, including just socially engaging of their choice, and then health monitoring. We were checking their weight, their blood pressure, their blood sugar, and all of those pertinent labs. So this is, we're now able to share that this is a recipe that essentially worked in that study group, and we're trying to get the word out there that these changes really do make a measurable difference. So go ahead, Jen. So as we kind of shifted into more of this, public health approach around risk reduction, just like public health addresses risk reduction in other disease spaces, we do a lot to prevent diabetes, to prevent heart disease, to prevent obesity, to, smoking cessation programs. And there's a lot of work happening in those spaces. And we realized with all of those scientific advancements, especially with the Pointer study, that now was the time to really take a look at how we could integrate brain health into those conversations. So we surveyed individuals. This was a pretty large survey, almost 4,000 people, 40 years of age and older, to really find out, baseline, what do people know about brain health? How do you think about your own brain health? How are you engaging in brain healthy habits? And how do you choose to participate in these things and receive information, because this is essentially the way forward in the approach to Alzheimer's disease. So some of the key takeaways excuse me, from this study. I find this stuff so interesting, and I have the pleasure of working on a risk reduction grant from the federal government, and this information is really directing how we approach communities. So some really interesting things here. 9 out of 10 adults in this survey said that maintaining brain health was really important, almost just as important as maintaining their physical health. So that was really positive. The negative is that only 9% of those people actually knew how to maintain their brain health. So really an opportunity right there. People generally knew, so about 75% of those surveyed knew that lifestyle behaviors were important for maintaining their brain health, but only 46% of them said that equated those same healthy lifestyle behaviors to reducing their risk for Alzheimer's. So that was interesting to me because people generally know, okay, these things are probably good for their brain, but they're not linking that to then reducing their risk for dementia. So another opportunity there. Um, it was really kind of interesting. If you could go back just one quick second, Jen, it was really kind of interesting what people thought were the most protective in terms of risk reduction. So head injury, a lot of people thought that that was really the most important, not smoking. So I was really happy to see that. Of course, managing stress and treating depression, but we're missing a few key things. If you remember from that Pointer study, we're missing heart health and exercise and diet. So people aren't necessarily equating those things to dementia risk reduction. Thank you. You can move on. So some other things that we found. People really understood that, sleep, diet, exercise, mentally stimulating activities are important, again, for brain health. However, and this is probably not a surprise to a lot of us, people weren't doing fantastically in these areas. So only about half of those surveyed reported getting about 7 hours of sleep most days. And we're learning that that really good quality sleep is the time that our body removes toxins and that waste removal happens. And some of those toxins that are removed is, the amyloid and the tau protein that we find in this disease. Fewer than half of those surveyed said that they ate a healthy, balanced diet and that they engaged in mentally stimulating activities. And then the worst statistic, which also is not really surprising to me, was the physical activity one. We know that about 50% of New Yorkers are in that physically inactive category, but only about 34% of those surveyed said that they were physically active each day. So that again presented as another opportunity. We know that people are interested in these things. You can see that they want to do activities like, cognitive exercises. That was at the top. And physical activity in terms of a person's desire to want to make a change there was kind of at the bottom. And that kind of makes sense because physical activity is a little bit more effort and a little bit more difficult. But overall, 73% of people said that they would be interested in participating in something that protected their brain health. So that was great. We looked at how people wanted to participate. So it seems like gone are the days, probably thanks to the pandemic, that people want to participate in things in person. They much prefer self-guided methods, hybrid methods where they can do some things on their own and some things virtually. So that is a factor. And obviously cost, insurance coverage, program location really play into that. We also know that from our survey that people view midlife, so age 35 to 64, as the key time to act for better brain health. So that's good because we have also shifted to really reaching people across the lifespan, especially those middle-aged individuals, because we know, the earlier that we can intervene and put some of these healthy lifestyle choices in play, that is going to have a cumulative effect over the course of a person's life. And it's much too late if you look at the overall picture to intervene with people when symptoms occur. So that was really great. It is a lifelong endeavor, brain health. It starts in early childhood and, continues throughout the continuum. But overall, people are thinking that this is something that we should act upon earlier. This was interesting to me too. So most people want to hear about this from their provider, which that's not the interesting piece. We would expect that. The interesting piece is that only 14% report ever having had a conversation with their doctor about maintaining brain health. So as nurses and the work that I do at the Alzheimer's Association, there's a big push to get this brain health and risk reduction information into the hands of the clinician, because just as you are having conversations with patients about keeping their blood pressure within normal limits and their weight and trying not to develop diabetes, we need to start talking about brain health in that way too. We have a lot of work to do here, and this statistic is kind of proof of that in that provider area. So another, few interesting things here. What do people think good brain health actually means? Kind of ran the gamut, but a lot of people think that it means thinking clearly to make sound decisions, being able to carry out your tasks, having a good memory. But if you look further down the chain there, not being able to manage your stress effectively was linked to brain health in people's minds. Maintaining a good mood was linked to brain health. Not having a mental health condition, depression and anxiety was also linked to brain health. So, we know that brain health is much more than memory, but it really shows kind of people's perception on, what do they think it means to actually maintain a healthy brain. You can see here, this was just how adults rated the importance of brain health activities. Super interesting. So we rated sleep as the most important thing that we can do for our brain health. Yet, in fact, I just read a report about brain health, or excuse me, about sleep in America and America having this sleep problem. And there's probably a lot of us on this call that don't get 7 hours of really good quality sleep each and every night. We know it's important. It's probably not the most important thing when it comes to dementia risk reduction, but people certainly view it as something, and we've got opportunity there. They viewed, a healthy diet, mentally stimulating activities, and exercise all kind of about the same as being really important. And then this was just about, healthy behaviors. We can see here that we're not really faring well in any of these categories. Only about half of those surveyed are getting that recommended sleep, and much less than half of those are getting, physical exercise. So as we're going out into communities, we're really trying to stress the importance of, you want to participate in some sort of physical activity with your doctor's approval, of course. And now you have one more reason to do so. Yes, it's going to help you with your weight and keep your bones and joints healthy, but it's also going to be a healthy activity for your brain. And this was, again, just about the interest overall. This survey showed people are interested, but they don't know where to go for information. They don't know what is most important. What should they focus on? It's very hard to focus on those 10 healthy habits. So if they had to pick a few, where would that focus? Where should that focus be? And so, as nurses, I'm hoping that, from today's conversation, you're understanding the importance of sort of where we are in the overall Alzheimer's landscape, and how we know we've got the evidence to say that these lifestyle changes are going to reduce your risk, and possibly in a really significant way. And the Lancet report told us that 45% of dementia cases could be prevented or delayed by targeting these risk factors. We've got to get the word out about it. Sometimes as people are going to their primary care providers and they're having those conversations about their blood pressure or about their weight, there's a lot of medications for things now. If you have high blood pressure, you can go on a medication to reduce your blood pressure, and that's okay, right? As part of a healthy, lifestyle. Dementia and Alzheimer's disease, to some people, it's a little bit scarier. And I hate to say that sometimes we need to use kind of that fear factor. But again, this now brain health is one more reason why we should engage in those things around blood pressure management and weight management and things like that. So overall, really interesting. Just want to very briefly, as we close out here, share, you can move past that. We already talked about that, Jen. Thanks. And that one too. And that one, sorry, these are repeat, just the slides on the talking points. So as as we end here and open up for questions, just want to share that, even though we've got this increased focus on risk reduction and meeting people much, much earlier in the lifespan, we will never abandon providing care and support for those that are impacted by this disease right now. So on the screen there, we don't have time to go through all of them, but if you go to our website or call our 800 number, you can get connected to the many services that the Alzheimer's Association continues to provide, both, in person in all 62 counties of New York State and virtually. We have a lot of information on our website now also about brain health, which is a great thing. And we have some additional resources. You can go ahead, Jen. Actually, 2 slides. Thank you. We have some additional resources now about brain health. So number one, if you wanted to share some, images and just information in your own places of work, we've got resources for you to do that. Personally, I guess, and for the patients and the people that you see, we have something called the Brain Health Habit Builder. So this is really an online tool that you can access in many different ways to check your current habits against, your current habits, what you're doing to protect your brain health, and it will help you develop a plan to improve on some of those habits. In communities now, we have a wonderful new program that we are happy to provide wherever and whenever. It's called Building Brain Healthy Habits. And this really goes into detail on the 10 healthy habits and shares some evidence from the Pointer study and other scientific findings that are really helpful to people. In that program, we also help individuals put a care plan together to make some positive changes in these areas. And then very recently, we launched a Brain Health at Work program. So this is a no-cost program for employers to help employers really start to create and think about brain healthy workplaces. So making sure there's some things that they are offering to support their employees' brain health, and at the same time are also providing employees connections to care and support opportunities, because we know that so many people in the workplace are also caregivers. And I see it in my own, small place of employment, and I'm sure you all do too. So that's a really new program. We're excited to launch that, and a lot of great things going on and advances sort of in all areas, right? In risk reduction and prevention, in detection and diagnosis. We've got blood tests now. In treatment, we have 2 disease modifying treatments. And certainly there are even some advances in care and support with the guide model and the dementia care navigation efforts that are happening. Next slide. So overall, really just a very critical time, I would say. As Jen mentioned, this is the public health crisis of our time. We are full steam ahead with, working on advances in all areas across the entire lifespan and care continuum. And we hope that you will, share this information going forward. And I think that was the last slide. Yeah. So I think we have a few minutes for questions. Thank you all for being here today. We appreciate